Okay, good morning, everybody. Welcome in this second webinar for the Stakeholder Board of Titan, which is organized per key expertise area. The Titan project is a Horizon Europe funded initiative, which is about enabling transparency in food supply chains via the implementation of digital technologies to boost health, sustainability, and safety of products, processes, and diets. Today in the program we have two presentations, and we are really honored to have these excellent speakers. The first presentation is given by Nicola King. She is based in New Zealand, and for her it's 9 o'clock in the evening, so welcome. And the second presentation will be given by Karin Jonnson. She's working for Paulig, and she's based in Sweden. Also welcome in the webinar. I will give a short introduction. Then we will have both presentations. There will be a short time for questions and answers, and then we will split up in two groups. One will discuss the subgroup ensuring food safety and authenticity, and in the other group we will be talking about informing and educating the consumer. In Titan, we have identified four key expertise areas, four areas that are really important for the work we are doing and the research that we are doing. The first one is enabling consumers to make informed food choices, and this is the key expertise area for which we have the webinar today. It is about ensuring food safety and authenticity and informing and educating the consumer. The three other key expertise areas are facilitating supply chain sustainability, and we had our webinar on the beginning of November on this topic. The third key expertise area is the implementation of new innovative technologies, and these can be split in faster and or more accurate detection methods and disruptive digital technologies. And the next webinar in January will be for this key expertise area. And then we have as a fourth key expertise area taking the food system approach, and we would like to move the food system to become more sustainable. And we would also like to support SMEs so that we all are successful in innovation. These webinars are mainly organized for the Titan Stakeholder Board, which is a large group of experts that are interested in the topics that we are working on. When you become a member of the Titan Stakeholder Board, it gives you the unique opportunity to be part of a collaborative community of experts, and you can actively contribute to shape the future of transparency and innovation in the agri-food sector. And membership benefits include to join a vibrant community, to stay informed and contribute, to expand your network, to have early access to information and multimedia, and to shape the future of our food system. These webinars I think are also, of course, highly interesting for the partners, and we advertise in other places, so we also get people outside of the stakeholder board. Please go to the website and check it and see if it is of interest to you. When you want to contribute already, you can contact us and say, well, maybe I could give a presentation in these webinars, I could help. Maybe you have some new publications, some news items you would like to share, please let us know. What we do as the Titan project is to publish a newsletter every 4 months, and the latest newsletter was sent around on Saturday. You can sign up for this one. It gives really nice information about what is happening in the project and what is happening in relevant areas, also from other initiatives. You can see I picked up some news items. There's a new paper published on the Titan project, driven by Isabel Gulings from ILSI, and it is really available for all of you. There was a study on sustainable diets presented at Eurosense 2024 by Noelia from ASTI about one of the pilots we have in the Titan project. And Esra from Technical University of Delft, she gave an oral presentation in which she presented about the first scientific publication that she published as a PhD student. Part of this Titan newsletter is a PDF with a large list of papers and reports that we think are relevant for the areas, for the key expertise areas that we are working on. And this is part of the newsletter. They are separately stored on the website. But I put up some examples from this one that are relevant for this webinar. How to ensure food safety in a circular economy. That's a report from the FAO. Voluntary versus mandatory food labels. This is a paper published in Australia. So that's as close as I could come to Nicola in New Zealand. Then a paper on antimicrobial resistance, a concise update. This is something that of course is important. That's an emerging risk for the future. And then examining socioeconomic differences in acceptability and preferences for policies that aim to reduce socioeconomic inequalities in health. I put up this one to show that we also look at the food system approach, that there are more aspects like the decisions of policymakers that influence what we do and what is the state of the food system. Every week we publish the Titan Weekly on LinkedIn, which contains a number of news items that we think are relevant, let's say from the past week. I put up here the ones that are relevant for this key expertise area. We try to put up every week 4 news items relating to food safety and authenticity, and 4 news items that relate to educating the consumer. There are also upcoming webinars mentioned, upcoming conferences that are of interest, and opportunities like trainings or awards that you can win or funding that you can get. Then for the next webinar, this is probably will take place on the 16th. So on the left, that's not correct. And this is for the key expertise area development and implementation of new innovative technologies. The first presenter will be Michele Suman. He is employed at Barilla in Parma, but he is also an adjunct professor at 2 universities. And he will speak about new detection methods for food safety and authenticity. And he will mainly focus on LC-MS, like more chemical detection methods. And then Francesco Muredo from the Lisbon Council will give a second presentation about the transformative impact of disruptive digital technologies. And Francesco is involved in 2 other EU projects. One of them is Watson, and Titan is quite well linked to the Watson project. So we think this is another that's interesting lineup. So please put it in your calendar, and we keep you informed when there are changes. This is my introduction. Please go to the LinkedIn page, go to the X link and to the website to get more information, and please interact with us when you like to. Thank you very much. And now I give the floor to Nicola to give her first presentation.
Good morning, everyone. And I believe this is not the usual time that you would meet, so I definitely appreciate that you have met a little bit early to allow for my slight change in time zone here. So my name is Nicola King. I also get called Nikki quite often, which is perfectly fine. I work for the Institute of Environmental Science and Research. This is what we call a Crown Research Institute, and that it's government owned. And within ESR, we do a whole range of different sciences, but it's all about human health. So it's everything from forensic science research through to environmental health, public health, and of course, food safety sits among that. For my sins, I am also a member of the New Zealand Food Safety Science and Research Centre, a member of their science team there. And this centre I mention now because it will come up again throughout this presentation. The logo is just in that top right corner there. This centre is a virtual centre, and it brings together the New Zealand government, particularly our ministry that's in charge of food safety here. It brings together research institutes such as the one that I work for, ESR, plus others with an interest in food safety. And it brings together the New Zealand food industry. And it was set up in response to a major food safety scare that we had in New Zealand that went around the world in terms of the problems that it caused many years ago to do with our dairy exports. So it was in response to that to enable the food industry to have ready access to science and research. So with that wee introduction, I actually am here today to talk about something called ERIS, our Emerging Risk Identification System. And I'm a lead for the ERIS project, and the two other people in this image here are my team. Arby works with me. He works out of a different site. He works in a place called Christchurch, but also for ESR, and he's our chemistry expert. And Kate, down in the bottom right there, works for our food regulator, which is New Zealand Food Safety. And that provides us with a really good connection through to our food regulator. So what I'm going to do is kind of two halves. The first part is just to give you an overview of what ERIS is and what we do and why we do it. And the second part is a bit I'd like to focus a bit more on, which is the what ERIS has done for those involved. So because I know there is quite a strong focus here on consumers, I thought I would start with the consumer picture here in Australia and New Zealand. And I've just cherry-picked the top statistics from 3 different surveys, and these are 2. So one of them is the World Risk Poll, and in 2021, they actually asked people, you know, whether they were worried that the food they ate could cause them serious harm. And here in Australia and New Zealand, you know, just sort of about that 74% of people were not worried at all. And, you know, there's another block there somewhat worried. So some, you know, reasonable confidence here. Food Standards Australia and New Zealand is, without getting too detailed, it's another authority that sits across Australia and New Zealand and sets our standards for food safety. They also did a survey, and again, that 70% mark, consumers were pretty confident about the safety of the food here. And this is a third survey that was just done in New Zealand. And in this one, you know, it looks a bit busy, but the takeaway message here is that top bar, again, we're sitting around that 70–80% of people think food is pretty safe here in New Zealand, but a little bit of a, you know, a difference in what they think about food imported from overseas. They have less trust in the safety of food imported into New Zealand than they do local producers. So some little subtleties among what people think in New Zealand. But of course, consumers are presented by headlines such as these, and that can create a lot of fear. And what doesn't overlay that, of course, is the message about what the actual risk is and whether indeed any of these things are a risk to health or indeed a problem in food. And I've just put this image in here. It's from a paper published back in 2022, but I really liked this paper. And these authors went and they asked a group of experts who they defined as people who had worked in things like nutrition and food science for at least 5 years on how much they were concerned or felt that these items around the outside were a risk. And that's the orange circle. And the closer it is to the centre, the less risk they perceived those things to be. So if you cast your eyes on that blue circle, you can see it's further out. And so consumers perceived these things to be of higher risk. And so it doesn't matter sometimes how much science you put out there, that perception is really quite different to experts. And some of that may indeed be because of these kinds of headlines to the left. But there's those of you in this audience, I'm sure, who know much more about this because this is definitely your expertise area. But what we can't forget is that, yep, we have the consumers, but those who produce food are also consumers. And then they have the added burden of ensuring that the food they produce is safe and suitable for consumers. So on top of that, they need to be really thinking about the hazards that could be present in their food. They need to be thinking about what that means in terms of market access or any other regulatory requirements. And on top of that, they need to be thinking about all these things coming at them about new risks and new hazards, and really, what does it all mean? When the New Zealand Food Safety Science and Research Centre was set up, one of the things it pledged to do was to put in place a system that would help the food industry to identify their emerging food safety risks. And I was asked from the start to get that off the ground. The first thing we did, of course, was not try to reinvent the wheel, but we looked around to see what other people were doing around the world and took the learnings from them. And we came up, I think it was 13 key learnings, and those things provided the basis for what ERIS is today. And I just want to share 3 of those because I think they're quite relevant to everybody. The first is that horizon scanning needs to be integrated with end users. There's no point in setting up any sort of emerging risk system if those end users aren't involved in using that intelligence in some tangible way. I've stopped sharing. There we go. The second is efficient horizon scanning revolves around expert opinion. Now, of course, machine learning and AI have come a heck of a long way in the last few years, and we're seeing that being applied, different methods being applied in the emerging risk and horizon scanning space. But experts are still critical, and I think will remain so for some time yet. And the third, a horizon scanning system should be part of a network of like systems, meaning don't do it alone, because everybody can do this much better if we connect and share intelligence. So ERIS is jointly funded. It's funded by our New Zealand government through an in-kind contribution. That's the lovely Kate Thomas, who you saw in that first slide. They have donated her to us for this project. And we're also co-funded by one of our ministries as part of the way that research is funded through the Food Safety Science and Research Centre. But the other part of ERIS is, half of ERIS is funded by these organisations you see to the right. Now, you don't need to know what they are. You can, they represent our red meat, poultry and eggs, horticulture, seafood, and Assure Quality sort of sits across that in terms of assurance and food testing. So we've basically got all of the key primary industries involved in ERIS. And this basically summarises what we do. We gather intelligence on emerging food safety risks, and we support decision making over future research. Because this is done through the centre, our focus is on what research we might need to get underway to mitigate or avoid emerging food safety risks. So very much a research focused rather than a rapid response focus. This is just a little bit more in detail about how we operate, but the parts are all there. Intelligence from various places. We had a panel set up for a little while with various people from throughout New Zealand with different expertise areas, say veterinary science, human health, product development. The ERIS coordinators, that's myself and my team, alongside all the other work we deliver, we need to look at all this information, determine whether there's any signals of an emerging risk, and we take that through to our action forum. Now that action forum is formed from representatives from those food industries that you saw, from New Zealand Food Safety, our food regulator, and from the Food Safety Science and Research Centre. And together we talk about these different issues and we make a decision about whether we just park it to the side and keep watch, we need a bit more information, or indeed we actually need to get some research underway. So you've probably seen this before if you've read anything about emerging risk type things. We're interested in emerging biological, chemical or physical hazards, but we're only interested in those that potentially cause adverse health effects in humans. So if they only cause adverse health effects in animals or plants, that's less of interest to us, although we might bring it up out of interest to our action forum. And we're only really interested in that dietary exposure. Of course, thinking about those other exposure pathways, but ultimately we're just looking for a signal that something's changed, something's different. And when you've been in the food safety world for long enough, you start to get a bit of a sense on where something just feels a bit off or something's not quite right and you need to know a little bit more. And just finally, we do various ways. We share our intelligence various ways. We have briefing notes that we provide to our action forum on various issues. We do have a public newsletter that comes out quarterly and that just summarises some interesting information that we've found over that quarter, and then a whole range of other things. We contribute to various meetings and participate in the EFSA emerging risk platform and support others in their communications where they might want information on emerging risks. So now let's get to the really interesting bit, which is the what has ERIS done for those involved? And while I've got a 3-year conversation, I realise actually we're coming up good 3.5, getting into the 4-year mark now since we began. And I've just got 4 really simple slides where I'm going to share with you these 4 points and give you some examples. But really, it has felt like an ongoing conversation and a learning journey for all of us. So the first is around perspectives. Now, as I mentioned, our Action Forum or our industry funders sit across multiple types of industries. And so when we bring an emerging risk to the group, they will view it through the lens of their own experience and through the lens of their own industry. And I just want to provide a couple of examples. So one of the things we've discussed over the last wee while has been rare earth elements. And this is a group of 17 elements, and they have very similar chemical and physical properties. They're not actually that rare, they're just very difficult to extract through mining because they're in quite low concentrations. But these are really valuable elements. They're used in electronics like LED bulbs and batteries, and you can imagine with increasing electric transport, these are in quite high demand. They're also used in medical imaging. So they're really, really valuable, and clearly there's an environmental contamination issue around mining, as there are for all mines. But the conversations we were having was more around what could increased use of these rare earth elements mean in terms of wider environmental contamination as we think about these products coming to the end of their life and perhaps going to landfill or being inappropriately disposed of, or even surrounding recycling areas. Is there a possibility these could get into food and water, and could they pose a risk? So that was really where our perspective was in terms of discussion. But our Action Forum, we're more thinking about in the future and thinking, well, what if in the future there's good evidence that at least some of these actually pose a health risk, and a limit gets put in place for one of the markets that we export to? What does that mean for us here? And that question came because they were thinking about the soils in New Zealand. And so they said, well, do we have naturally high concentrations of these in our soils? And so that was a piece of information that we went off to hunt out to just sort of complete that picture a bit. And it's just a really different perspective. The other topic here, cyanobacteria. These are also often called blue-green algae, although they're not actually algae, present in freshwater globally. They rapidly multiply or bloom when conditions are really good, high nutrient, lots of warm weather. And some of the types produce toxins that can actually make people sick as well as animals. So we were talking about this from the perspective of climate change and potential increased blooms, and people needing to irrigate their crops because of water shortages and potential cyanobacteria concentration. But the dairy industry was saying, well, what about drinking water for animals? Is it possible that these toxins could pass into the milk and meat and therefore become a risk for consumers, or at very least a problem for the industry? And so again, we went and we found information to try and answer those questions. And if you're curious, yes, it is possible, but the information's quite scarce. It's not really a complete picture at this stage. So the next one is around learning, and I say learning for us as the scientists involved and for our food industry. So the topic of nanoparticles is huge, and we have looked at it from multiple perspectives. So when we talk about nanoparticles, we're talking about nano-sized particles, and these can be naturally present in foods, and indeed when you eat food, your body breaks it down into nanoparticles inside your body. So it's not really a bad thing. But what we were thinking about was the increased use of synthetic nanoparticles, so particles deliberately manufactured at a nanoscale for a specific function, and whether there were risks involved in these. So you can think about nanoparticles being used in packaging for some form of active packaging, or as a encapsulated ingredient in a food to deliver a functional chemical to the body at the right time, or even in the environment, nanoparticles being used to deliver agrochemicals in a more efficient way, getting it to the right place in the plant and allowing it to stay there for the right amount of time. So this nanotechnology is good, but where's the investigations about the safety, including the longer term thoughts? I'm starting to see words like nano waste appear in the literature now. People are starting to think about this down the track, what's going to happen. And this has generated huge conversations and huge learning for all of us. And it just leads on to this other one called biocoronas. So I don't know about you, but at the start of this year, I'd never even heard this word before. And it came up in a scientific article, and we investigated it. And what these are is it's recognizing that when the body absorbs a nano-sized particle, be that a manufactured one or just one from your food, it doesn't stay in that naked form, if you like. It can get proteins or lipids or other things attached to it inside your body. And of course, that then changes the way that it's going to interact with your cells and proteins in your body. So it creates an extra level of complication if we think about risk assessment, and we're quite curious to see where these conversations might go. Our third one is trends. And I've just picked a couple here of just things we're seeing coming up more and more, and the story is just slowly changing over time. And the first one is around what we're calling new foodborne pathogens. They're not really new, most of these. They are bacteria or viruses or indeed parasites that people know about. But what they're doing is using more advanced methods and better methods, and they're doing specific surveys to look for these in foods. It doesn't necessarily mean that their presence in foods will lead to a negative health outcome for somebody who eats that food. And some of these are well-known pathogens that you see turning up, particularly in healthcare-associated infections. And people are now saying, well, what role does food have in making people ill with these pathogens? And a lot of the time, there's not good evidence, but sometimes it can be enough that you need to really keep on top of these. And just some examples, HE virus, which has been around actually for a long time. It's actually called Kobu virus now. It's been around for a long time, but you need specific tests to look for it, and people are starting to look for it again. Helicobacter, Archobacter, these are bacteria that are related to Campylobacter. How much they actually are involved in terms of human negative health outcomes and the role of food in that is a little unknown. You can think about fungi such as Candida, which is well known as a cause of disease, particularly in healthcare. And more widely, you can think about things that rely around antimicrobial resistance. Now in ERIS, we specifically don't monitor a lot of the stuff around antimicrobial resistance because it's a big topic in its own and we simply don't have the resources. But we're certainly seeing things like surveys looking for MRSA, the Staph aureus, things like that. And the other one is mycotoxins. So we have our regulated mycotoxins, the one that people are required to test for, sometimes in feed, also in food. But now we're seeing what they're calling emerging mycotoxins. Now they're not new. It's simply they are the toxins produced by fungi, and often the same fungi will produce a regulated mycotoxin, one we know about, but it will also produce other toxins as well. And these ones are not regulated. Often there's not good data to demonstrate any connection to human health, but that data is building, as is data about the concentrations of these mycotoxins in food. So we've looked at this again from multiple angles, including thinking about emerging technologies such as biological approaches to mitigating mycotoxin contamination. And finally, connection. So I mentioned, of course, that we need to be connected with each other. And I'm very fortunate to be invited to the European Food Safety Authority's regular meetings of their stakeholder discussion group on emerging risks. It's a wonderful platform to share intelligence. And just some examples, I was able to share some information around the expansion of rat lungworm into the intercontinental Europe that they hadn't quite picked up at that point. And in return, I was able to view a really excellent presentation around plastic mulch being used in horticulture and the contributions to microplastic contamination in soils. And Food Standards Australia and New Zealand also have an emerging risk team, their VIBE team, and we meet with them regularly and we shared some information around tire particles and environmental contamination and what that might mean in terms of food production. And they gave us some signals around a bacteria called Helicobacter pylori and the potential for poultry to be a vehicle of infection there. And finally, I've put highly pathogenic avian influenza on the bottom, a disease that I believe there's very few places in the world that hasn't touched the poultry industry yet. And it's quite timely because this week marks the first week where we've actually had an incursion here in New Zealand in a couple of egg farms. But I mention it not because it's a food safety issue, because it's really not at this stage. But I mention it because what I saw is that through those relationships that had developed, when this emerged in the US among dairy cows, you can imagine that our dairy funders were incredibly interested in what was happening. Now, the two dairy industries involved in ERIS are actual really big competitors, both in New Zealand and in the international export market. And in other situations, they would not be talking to each other. And yet when this broke in the US, I was copied into a flurry of emails where they shared with each other intelligence that they had sourced from their own networks from around the world, from the literature. And it was just a really wonderful thing to show that level of trust that had developed, you know, that belief that food safety was everybody's business and should not be a competition or a competitive advantage. So that brings me to my the end of my slides. I hope I'm on time. I think I am. And I believe, Edward, we're going to have questions a bit later. I don't know where Edward's gone.
No, sorry, I had a problem with Edward. Just give me a second.
No problem.
Okay, Edward, now it should work.
Thank you very much, Nicola. It was an excellent presentation and really nicely in time. And indeed, we do the questions later. Please, everybody in the audience, when you have a question for Nicola, save it, and then we can discuss it 20 minutes from now, because now the floor is for Karin. Please go ahead.
Thank you. So I will share my presentation and give an introduction. Okay, I hope everyone can see my slides. I'm very happy to be here, and my name is Karin Jonnson, and I have been at Paulig for 4.5 years, looking after the sustainability on the product portfolio level, which covers both aspects for planet and people, and that includes the nutritional aspects. And my background is from the academia as a researcher in public health and also consumer sort of behavior, and also have driven a lot of collaborations across academia, industry, and public sector, as well as been a consultancy towards industry in nutrition-related matters. And I'm going to share how Paulig works with NutriScore and how the label can be a guide apart from guiding consumers to healthier choices at the store, but also for companies, like being a responsible approach toward creating more healthier products. Firstly, then, I would like to welcome you to my working home, and that's Paulig. And Paulig is a family-owned food and beverage company that has been around for almost 150 years, and that aim to be one of the fastest growing food and beverage companies in Europe, and a sustainable frontrunner, which I'm very happy for. Today, we have operations in 13 countries with over 2,000 colleagues around Europe. The headquarters is located in Finland's capital, Helsinki, while I am located in Sweden, and more precisely in Mölndal, right next to Gothenburg, that is Sweden's second largest city. And Paulig's markets span across 70 countries with brands such as Paulig, that's coffee, Santa Maria, Risenta, Pocolocco, and Sanoi, as well as private label products. So the type of products that we have, well, we love tacos and Tex-Mex and other world foods such as Korean-inspired or Indian-inspired. And we really love coffee. And some fun facts here is that Paulig's head of cupping tastes 200 to 300 cups of coffees during one workday. Also, Finland is the country drinking most coffee per person in the world, where Paulig is proud to be a market leader. We're also really proud of our high quality and award-winning flavoring assortment of over 600 products. And then we also have seeds, kernels, specialty flours, and this is mainly on the Swedish market. And recently, we've also tapped into the world of snacking. But now I would like to take you back to the ambition of being one of the fastest growing food and beverage companies and a sustainable frontrunner, and especially then to the latter, which I'm very proud of. Paulig has incorporated sustainability into the business strategy, and here I'm displaying our current main focus areas for the year 2030. The sustainability agenda is ambitious, and it's based on science and where we have the biggest impact. And we're focusing on 3 overarching areas. The green one there, it's climate and nature actions, for example, through our science-based greenhouse gas reduction targets, and also being in the process of creating goals for nature. Then we have this red bubble. It concerns a fair and inclusive way of working, especially in high-risk areas. And then 3, the yellow bubble, health and well-being of people and planet, and that's on the product level. And I will give you a closer look at the yellow bubble, which is the area that I am leading. So the ambition is that by 2030, 70% of our total sales shall come from products that enable the health and well-being of people and planet. And this is a comprehensive and measurable target. But what does health and well-being really mean for product? So a cornerstone of this is to properly define what it means. And the focus of this presentation concerns health for people. And to define a healthier product for our 70% people healthy target, we have created a nutrition framework. And just to give a bit of background how we have worked when we were developing the nutrition framework, in our view, a nutrition framework should align with dietary guidelines, enable a fair and comprehensive evaluation of products and product categories, and enable clear and transparent external communication of targets and status. And for the purpose, we screened numerous front-of-pack nutrition labels that are independently developed, and we were reviewing a few more closely, and we landed in NutriScore. We see that NutriScore comprises several features for a good nutrition framework, or a nutrient profiling model, if you like. NutriScore considers all relevant nutrients, such as energy, saturated fat, salt, sugar, and fiber. And it also considers many foods that dietary guidelines recommend us to consume more of, which incentivizes us as a company to use more of these food groups in our product development. Also, the NutriScore model gives us guidance on all products, not only the best, which is the case for binary models, like a green tick for only the healthier one. And we also see benefits of all foods being judged per 100 gram, as is the case for NutriScore, rather than per portion, because not only may it be difficult to agree on a specific portion size of all food categories across all countries, if you'd like this to be sort of valid for all, but only one portion is not always consumed, and especially not by those people that need the dietary change the most. And then just by being a front-of-pack nutrition label, it works well for external communication of our goals and overall status with its 5 grades, allowing for transparent communication of nutritional quality of all our products. And then NutriScore is the most commonly used in Europe today. I want you to note that we have not yet decided to put it on pack, since we have been waiting for a European proposal and sort of decision to harmonize the use of front of pack nutrition labels and make it mandatory. But unfortunately, this proposal has been delayed. But Paulig, we hope for it to progress. And for this purpose, we endorse NutriScore. But if this will be a true and valid proposal and decision, we will welcome any decision that will be taken and sort of change our approach accordingly, of course. And then I just want to highlight that as for any other label, NutriScore is not perfect. But based on the research that we have done and the sort of the scientific research that we have read, the features of NutriScore comes out best suited for its purpose. And if we would wait for a perfect nutrient profiling model, we would need to wait forever, and that will serve no one. So we try our best to be part of development discussions in the areas that we see could benefit public health even more. And then development discussions concerning NutriScore then. Then for our target of 70% sales from products enabling health and well-being of people by 2030, I have a reminder up there in the top right corner. We let the green colors A and B of NutriScore guide us toward products with sufficient nutrient quality. Just want to let you know that it's not so straightforward. When it comes to spice mixes, for example, it's a bit tricky because NutriScore is measured on 100-gram product, but no one ever eats even close to like 100-gram spice mix, since the purpose is to dilute it with, for example, minced meat. So instead of just taking our spice mixes out of the picture for improvement, because it wouldn't be relevant, but we are then instead looking toward how can we steer the use of the spice mix and spice mix meal component through information on pack and our recipes in marketing and communication. And this would mean setting limits for meat like beef or pork, but instead encourage chicken and vegetarian alternatives and sort of calculate how would that be green. Then we also have coffee in our portfolio that scores green, B, and this is fully in line with the scientific view of health benefits of coffee that is shown to decrease the risk of important diseases. However, the unfiltered coffee, like pot brewed coffee, may elevate cholesterol levels, and because of this, the coffees for which we only have instructions for pot brewing are taken out of the definition of a sort of product enabling health. It doesn't count to that sales in our target, even if it scores NutriScore B. And then in addition, a little bit outside our nutrition framework for the target, but we let NutriScore also guide our use of nutrition and health claims in the sense that only A and B scoring products are judged to have a nutritional profile that is good enough to have a nutritional health claim, even if a product happened to have one or two features that could reach a claim. But then coming back to our ambition of having 70% of our total sales from healthier products, I tell you, this is a really ambitious target for a company with general type products and a portfolio like ours with sort of products for enjoyable shared moments rather than having the main aim to be super duper healthy. So like, what are we then doing to reach this target? And we need to involve sort of the whole company, basically. We have a strategic project ongoing, which is led by sustainability, and it includes the heads of R&D, and it's steered on the director level and reported continuously to the highest leadership team and the board. In this project, we have created a roadmap that covers our core products and their reformulation pathway toward NutriScore A or B by 2030. And the main aim is not to sort of market these products as super healthy and make them more expensive, but to sneak in the healthiness so that the acceptance and the affordability are retained for all, so that we are not losing, of course, we're not losing business, but with that goes hand in hand. We're not losing sensitive groups that don't care about health or want to pay that extra price, because it may be those also that may need the dietary change the most, the ones that don't care about it. So I think this is really important for me driving the nutrition approach, that this should be changed in the core, not only an added benefits for those that can afford it. Then we monitor status and progress continuously, and the reformulation roadmap is reviewed each year. And for these purposes, we have built internal digital tools with visualization and scenario simulation capabilities. And you have a sneak peek there on the slide. And our portfolio's NutriScore status, measured as sales, is disclosed each year in our annual report, so it's official. And speaking of this, I would like to mention also our participation in a global alignment project led by Access to Nutrition Initiative that have had the aim to encourage and harmonize public reporting of food and beverage companies' health status of their product portfolio through well-established, independently developed nutrient profiling models. And this process included stakeholders from academia, NGOs, investors, and industry. And NutriScore was one of 3 endorsed models, alongside with Health Star Rating and the UK government's HFSS scoring system that sort of covers saturated fat, salt, and sugar. And to my knowledge, this is the first initiative of its kind. To finish off, I will share some key takeaways. First of all, make sure to anchor important nutrition activities all the way to the top, but even better, have it top down, all the way from the top. And I can promise you that when winds are blowing of sort of saving money and saving resources, it's a blessing to have decisions and approvals from the board and the highest leadership to do what you need to do. Not to earn money from it as the main goal, but to future-proof your business by being a sustainable and responsible actor in the food system. And use an independently developed nutrient profiling model for the company's nutrition work, and choose a comprehensive one that covers all product, not only the best performing product. And this is a great opportunity regarding responsibility to use it in target setting and status disclosure. And NutriScore, Health Star Rating, and the UK's HFSS models are proposed as good models for the purpose in a global alignment project that I just mentioned. Then Paulig uses NutriScore thanks to its science-based and intuitive visualization for disclosure of portfolio nutritional quality, for reformulation, target setting, and communication. And when we decide to have a nutrition label on pack, that would be NutriScore. And with this, I will say thank you, and being happy to be on time, and looking forward to questions and discussion.
Okay, thank you very much, Karin. Now we are exactly on time, so both papers are open for questions. So I would like the audience to invite to wave maybe when they have a question for Nicola or for Karin. Because otherwise I will start off with a question for Nicola. You mentioned in your presentation the aspect of connecting, and I think it also fits with you, but maybe you can explain why it's so important.
Yeah, what we recognise is that emerging risk detection is a really difficult business. And there's also the school of thought that there's quite a lot of different systems out there, so surely we're all repeating the same thing. Well, the reality is people, different organizations or companies or regulatory authorities, they set up an emerging risk system for food safety for their own purposes, and they often have their own approaches and their own needs. So for some, it might be monitoring, say, things like the rapid alert system for food and feed for rapidly emerging triggers around known food hazard combinations. For others, it might be casting their view right into the horizon. And when you connect with all of these people, you hear these different perspectives of what's important to some, and you find that there is an overlap. So in that last slide, I did try to provide some examples of where we've shared intelligence on specific issues, and it really enhances the work that we all do. And those connections are just really important. And I'm fortunate that I'm well connected to those here in New Zealand and Australia who are doing this, and the connection internationally is certainly growing. And the European Food Safety Authority's Emerging Risk Group, their No team, is remarkable, and dare I say it, a bit of a leader in this space, I think, in what they're doing in terms of bringing people together to the table to talk about these things and make decisions.
Okay, thank you very much. I see that Isabel Hofman has a question.
Oh, there we go.
Yes.
Hi, thank you. This is a question for Karin. So how would you score a product that has almonds? Because it's great to have, a score on food, but food is really dependent on the health of the individual. And almonds are considered to be typically quite good for everybody. However, if you have, colitis or some gastrointestinal problem, you should actually not eat almonds at all. So how do you deal with something like that?
Yeah, it's an interesting question. And I think that at Paulig, we deal with those types of questions a little bit similar as sort of our national, I can relate to the Swedish government and when they develop dietary guidelines. In order to sort of reach big, you have to sort of look at the common person. It's really difficult to tailor individual needs. So we go for sort of the common person, the public health, and sort of the general dietary guidelines that will be sort of the basis. So for the common person, and then if there are several others, this is a good example, but it's only one example of really a tailored individual tailored sort of diet need, and it's impossible for us to sort of cover that. So when it comes to allergens, for example, that's one other example, that it's actually quite many that have allergies. Then there's this regulation that we have to put these ingredients in bold. So that's one way. You can always find all ingredients in the ingredient list. And I think if you're a person with a special need, you would have to read the ingredient list and sort of understand your own need. But then for the general person that are not so aware maybe of its own needs or the general needs for a better health, I think they just need the quick fix, the easy way, and in the best way, maybe not even make a decision, but then have more fiber, less salt, and so on. Yeah, so we have a general approach.
I don't think you can really do a universal score label for nutrition. I mean, where do you put obesity and where do you put diabetes? Is this part of the common individual when we have, a growing population of epidemics with diabetes? Is it, now the common? I mean, where do you fit that?
Yeah, but that is actually, I think that so if you look at public health in general terms, there are strong evidence of what is good to eat and what is not in the general terms. And I think the problem today is not that our dietary recommendations are wrong, it's that people are not meeting the dietary recommendations or the recommendations. That is a very, very limited share that actually eats what we recommended to eat. So I think that is really the first step, that have the big part of the population eat what are recommended and what we know by science that will affect sort of the large masses. And if you as an individual have special needs, you would actually, unfortunately, but you would have to take that responsibility on your own. But diabetes and heart disease and and obesity all falls under what we actually have quite a lot of evidence today, if you look at the totality of evidence and what we can improve.
I beg to differ from you, because in fact, there's enough evidence, scientific evidence, that in fact, the dietary recommendations have allowed the problems of cardiovascular and obesity to occur. So, I mean, it depends really who you're reading and what you're reading. But the reality is that a NutriScore without an information about the individual I mean, it's useful in a certain way, but it's not at all. It will make people think that this is, a standard for everybody, and it's not. And if you look at the population is affected by all sorts of diseases. But anyway, I just
maybe then do you have the thing is that there is no perfect label that covers everything, and NutriScore gets a lot of criticism, but no one ever comes with a counter suggestion. This label would cover everything. So I think NutriScore is not perfect for sure.
I actually can give you a counter suggestion. If we have a health score for the individual, we can match the NutriScore with the health score. That's the only way you can actually have a proper, nutritional score for an individual based on their health. So yeah, if we have a profile, a genetic and, microbiome and so on, I mean, I'm talking about something that doesn't exist right now, but it's the only way to do it.
I thank you very much, Isabel, for your contribution. And maybe in the subgroup we can continue this, but there are more people asking a question. So maybe Nadia Kufaro, you can ask your question. Manuela, can you maybe unmute Nadia, because she is still muted? Or you can do it yourself, maybe now. And otherwise, Alejandra Rodarte.
Sorry, she can talk. Maybe she can write the question. Otherwise.
Alejandro, please go ahead.
Hi, do you hear me?
Yes.
Yes. Okay, thank you. Okay, my video is. I tried to turn my video. Okay, there it is. I had a question for Nicola, and thank you for this very interesting presentation about this new interesting field of emerging risk identification. I think there's a lot of work to be done in that field, and it also raises a lot of questions. And as you were presenting in introduction about the consumer having a lot of fears and the need to increase consumer confidence, through your briefings or what tools do you have internally to communicate about those new emerging risks in a way that can be also understandable? I mean, of course, maybe the briefings are for another target audience, but when the information goes out or it's published somewhere else, it can be misunderstood, and then that's how the ball starts rolling of consumer being fearful.
You're absolutely right. Yes, thank you. We have talked about this quite a bit, with our Action Forum and our industry funders, about trying to find the balance of starting to raise the conversation about an emerging risk, but raise it in a way that we're presenting it as it should be presented in terms of what it means for consumers before media gets ahead. And a really good example actually is the nanotechnology side. And we had a lot of conversations about whether we should start putting out some information around nanotechnology and the way it's used in food and the benefits of it and how risks are managed. But actually what the figure I showed was those circles in it that showed how consumers perceived things to be more risky. Interestingly, they didn't perceive nanotechnology to be that risky because they simply didn't know anything about it. So as soon as they start learning about something, but they don't know enough, they get fearful. And it's that fear that starts to, create all sorts of stories that are hard to counter with what's really right. What we actually have done quietly is done some small publications. So I did help an article in a Food New Zealand magazine around nanotechnology, really balancing out the different views around it in food and providing some examples. But a lot of the emerging risk, we don't communicate a lot about it beyond that Signals newsletter that I mentioned that is actually available. We carefully choose the ones we feature on there because it's very limited space to create a proper story around actually what it means in terms of risk. So yes, there's definitely care. Most of what we do is provide the intelligence and the briefing notes to the industry so that they can be ready to respond. So there have been some issues that have come to us that have come through customer queries, actually, new things. And we've done some investigation, and that's now supported them to respond to those customer queries appropriately and get ahead of things before it starts to snowball. So yeah, it's a tricky one. Absolutely. Yeah.
No, happy to connect offline. I actually didn't introduce myself. Alejandro Rodarte from Food Drink Europe, dealing with food safety.
Wonderful. Thank you for your question.
Okay, thank you. Nadia, are you now ready to ask your question? You can unmute yourself.
I think she cannot unmute, but she wrote the question, so it's on the chat.
On the chat, okay. Yeah, it's a question, I think, for Karin about the proposed 2024 EU directive on green labeling. Can you give a reaction on this?
Yeah, this is we have EU directives on regarding nutrition and health claims already, and now it's emerging EU sort of directives around green claims, and basically anything a company say about sustainability on the product level. It's under development. We are monitoring this closely because we have a few green claims out there, like carbon neutral, for example, and some other green claims that we are really now learning. Okay, but what can we say? To my understanding, it now, since sort of my presentation is concerned the nutrition, to my understanding, sort of the nutrition claims will still be sort of regulated in the with the nutrition and health claims regulation, but then all other sustainability communications under the green claims. But I'm a little bit unsure of how those two align. I'm not sure about the specific question. It's really a topic we monitor, and we really aim to abide to this, and we think it's quite positive that sort of companies would get clear guidance on how can they communicate in a transparent and true way to the consumers, level the playing field and everything. But as in many cases, also when legislations are created, it's a long waiting time where we don't really know what exactly to do and will it even come? So did you understand that about the specific question more than sort of a little bit elaboration?
I think you answered the question, because as far as I know, there is an ambition in the EU to also have a label on sustainability on products, but let's say to what extent it is developed and when we will get an update, that is unclear.
Yeah, and that is another thing. As the green claims, we have a sort of directive called Empowering Consumers that sort of says what companies cannot say when it comes to sustainability. Yes, and they're developing a directive. Okay, but what can we say? How should we go about if we want to say something like a claim? But then you're completely right. There's also been these discussions that would EU actually, because the green claims would forbid companies to have their own sort of developed labels. It need to be a third party verified, and it need to be a methodology that is maybe approved by EU or a government or something. So a lot of green sustainability labels will be prohibited. And there have been these discussions, will EU develop their own sustainability label? I think that is even further away maybe than the actual green claim sort of directive, if I would guess. But I would be very open to that as well. in the same manner that we are developing sort of a framework for our nutrition work, we are also looking how can we develop a framework for our planet health, and we're looking into independent sort of holistic measurements. So we really welcome the EU with guidance on this. And if there's, I see this looks like someone from Sante here. I mean, yeah, clarity and progress in that area is much welcome from our end. And we want to do right. It's just sometimes difficult to know how.
Okay, thank you very much. Then Eva Lien, please ask your question, but I think she has to be unmuted.
No, I
Yes.
think it's okay. It's similar to what Nadia just said, but thank you both for the talks. It's for Karin, so hey Karin. With what Nadia said, it's kind of the sustainability aspect of it, whether you'd considered the sustainability labelling as well. But I've just seen she's put in the chat about reducing the proliferation of labels. So whether or not from a company point of view, you thought about combination of labelling or combining the labelling, because obviously you have some things that might be sustainable, or you might promote it as being sustainable, but that doesn't necessarily mean it's healthy, and kind of like these areas where the two don't go hand in hand, and perhaps a lot of consumers might see a healthy NutriScore and also perceive that they're buying something that's environmentally friendly or sustainable, but that might not always be the case. Just kind of the status of the discussions from a company to see how far along that might be taken, that discussion.
I think it's a really good question. It also taps into what Isabel was brought up, but sort of the other end of it, because let's say if we would make a combined sustainability label that includes the nutritional aspects and all the sort of important environmental aspect, we would come even further away from the personalized nutrition and information, like on the detailed guidance level. So what we have sort of placed ourselves somewhere in the middle there. Unfortunately we cannot give too detailed information, because it would be so much information if we would at this point, since we don't have a better option. So we have then a clear nutrition label, so that people that have actually, maybe there are some people that really need this guidance more than other, maybe then they can make an informed choice about nutrition parameters. But then we are taking the other aspect into consideration as well, because in this goal is 70% of sales coming from products that are healthy for both people and planet. So then we take the other planetary aspects. We're using a startup actually, or not a scale up maybe, that has 8 core metrics. So not only climate, but climate, water use, land use, biodiversity, and so on. And they really try to base this on sort of research and best practice, and help us to assess our status in this holistic manner. And our ambition is also find some kind of independent measure, what is a healthy enough, like a planet healthy enough threshold for us to aim for. But we're really working on this, so we have nothing yet finalized to present, but we've taken that approach to separate it, to make it a little bit clearer from the nutrition point of view, but then really consider as many aspects as we can on the planet side as well. And what we do, we base these targets on the total sales. So it's still 70% of our sales. We think that the impact in totality will still be the same. 70% sales from planet healthy product and 70% sales from people healthy product. The impact in totality will still be sort of the same. But then also good to mention that this approach is not, we are not relying on consumers taking an active choice. Is good, of course, if they can, but we are doing this anyway. We have committed to have 70% of our sales coming from better products, so the consumers doesn't even have to make that choice, basically. And personally, coming from a science sort of background, I think that's the strongest that we could do. Not only relying for people paying more and sort of drive the consumers will never drive the shift that is needed to the extent that it's needed. But we are waiting eagerly for a good sustainability label that will not be prohibited, and it will be endorsed by EU or somehow. So we could also start working in a more sort of maybe official guided manner. Maybe not a straightforward answer, but it's a important and complex area.
Okay, thank you very much for your answer. You may mention the scale up you're working with.
Yeah, How Good it's called.
How good? Okay.
And we
Thank
done
you.
also thorough research there, and we were really they were standing out to us with this holistic approach that we cannot look at only carbon, we cannot look at only carbon and water, but try to really measure holistically. And we think they are doing a great job. They're more commonly used maybe in US at this stage, but also in Europe, and also more commonly used by retailers at this stage. But they are growing, and I think they should.
Okay, thank you very much. Because I know Carbon Cloud, I think they're also Swedish. They're at least
How
making a
Good is not
database.
Swedish, but that is then focused on the carb, so it's a little bit other more targeted focus there on the carbon, and I think traceability to in the value chain. I shouldn't say too much because I'm not 100% sure, but yes, you're right.
Yeah, but
there
okay.
are several startups, super interesting startups and scale ups in this, and they're really needed. So.
Yeah. Okay. Thank you very much. I'm going to ask a question for Nicola, and then we have us at the last question from Akiva. So you at the end you mentioned that FS Sons that they also do this type of work. So maybe you can explain why do they do this separately still, or maybe that's going to change in the future. And then specifically about the tire wear particles, because I've seen some news about this in the past time. And are there made connections with the industry that makes tires, if they can make changes for the better? Maybe that's the next
I
question.
don't think I could answer your third question, but certainly the first two. So FSANZ it stands for Food Standards Australia and New Zealand. So they set the food safety standards for both countries. And then New Zealand has the authority to also set their own within that and over top of that in certain areas too. So FSANZ have been doing the emerging risk work for longer than us, and they have set up a system again for their own purposes. So when we get together with them and talk about things that they've noticed from their business as a food regulator and a standard setter, and what we've noticed from our business in the food science, food safety and industry space, there are differences between what we look at, and there are things that they look at that don't interest us and vice versa. But there's that place in the middle where our activities overlap. And that's where we try to work so that there isn't duplication of effort. So that if one of us have pulled information together on a topic area that's of interest to another, we can share that. And so we have very good relationships with them. And New Zealand Food Safety, our New Zealand Food Regulatory Body, or competent authority, I think you call them, don't you? So they also have an emerging risk team. And from the outside, it looks like, why are we all doing this in this tiny part of the world? But it's the same situation. What they look at, a lot of it is not of interest to us. And same with what we look at, a lot of that is not of interest to them. They're doing it for their own purposes and their own reasons. But there's that happy place in the middle where we share information. And it just reduces that duplication of effort. And also, by virtue of each of us having our own networks, it actually expands our reach into other sources of intelligence. So it's a really beneficial thing that's going on here.
Okay, thank you.
Oh, tire wear particles. Sorry, quick summary, because I could see the clock ticking. I forgot you had that other question. So tire wear particles by definition are indeed just fragments of actual tires, but what we're really talking about is tire and road wear particles. It's the particles of mixed, road seal, dust, bits of tire, bits of fluids from cars that have dropped off, the general detritus that builds up on the sides of roads by virtue of vehicles simply driving on roads, and that moves, of course, into the environment. Particularly, it's can be carried with water quite happily, and so there's not a lot known. It seems to be an emerging kind of area of research in terms of what it poses to human health. Obviously, it's going to be highly variable, but chemical hazards are probably the more likely hazard that we would be facing from those chemicals leaching from those particles into water and into soils.
Indeed, yeah. From what I know, is that there was a short discussion on LinkedIn about on certain places if they would still be allowed to eat the vegetables they grow in their garden because there was a highway close to them. They were a bit surprised, but I've seen earlier news items about the negative effects of traffic on salmon. So when you have roads close to water streams, and it is a certain chemical from the tires that ends up in the water and that has negative effects. So I agree there's not much known about it, but it goes into this direction. And then, of course, the next step could be to flag this and to start conversations with the tire producers to see if they could change something.
Yeah.
Okay, thank you. And then Akiva, please speak up, ask your question. Yes, please.
Hello, am I audible?
Yes.
Okay, thank you for the talk. And my question is for Karin. It is when it comes to NutriScore, there are mixed opinions. Some think it is beneficial and some think it's misleading. So how do you tackle this perspective at Paulig?
Yes, I would also come back to what I said before and what I also mentioned in the presentation, that first of all, there are no label that is perfect. If we should wait on a perfect label, we will wait forever, and that will really not benefit anyone. And my view is that in the large picture, NutriScore can really be a beneficial sort of tool towards public health. And we are using this now internally just to improve our products. And for that, it is sort of undoubtedly a really strong tool for us to reduce salt, reduce saturated fats, reduce sugar, increase fiber, increase healthier food components, everything that goes hand in hand with the well-established dietary guideline. So it works really well for us internally, and we have not yet put it on pack. And I assume that maybe it's your question concerns sort of that it may be misleading sort of on pack for the consumer. And for that question, I would say 100% it can be sort of probably it should be and can be developed as any other label, but we did quite a lot of our own sort of research where we investigated what is there out there, what is the evidence for the labels out there, and also looked into sort of the European Commissions. They have done 2 reports on the area of front of pack nutrition labeling within sort of their previous mission to harmonize the front of pack nutrition labeling. And it was really helpful. Sort of they were gathering evidence, and sort of the features of NutriScore with this sort of, first of all, that it covers all foods, not only the best ones or the worst ones. That is the number one thing. I would say that anything that does not cover all foods will be less helpful. And then the NutriScore has the colors, sort of, so it's really intuitive. And the purpose of a front of pack nutrition label should be easy, at a quick glance, sort of easy guidance. And there are a few other sort of labels that are so easy if we talk about sort of the features. But then if you look into the actual details in the model and algorithm, yeah, I have a few things that I could sort of bring up that I think it's a little bit could be improved. But I think then instead of saying no to a label that actually can help people, we try to be part of developing it. We want to be part of the discussions and point out, okay, here and here we see development potential, but we also have to sort of lift the eyes and see, okay, if we're just waiting until it comes the perfect label, there will be nothing, and that will be worse. So it's just being part of the discussion and development sort of work around front of pack nutrition labels. And to my knowledge, there is no other label that has as much sort of scientific support as the NutriScore. So it's more that it's a choice of the best that we think there is. But we are also very humble that if EU or any other company or researchers provide evidence to say, oh, but here's an even better front of pack nutrition label, we're super happy to sort of discuss and endorse that one, or sort of switch. And we don't want to say this is better than everything else is bad, just that we need to do something. We as a company need to take responsibility of our sort of reformulation and our products, and it has been a super good guide for us. So
Okay, thank you very much.
Okay,
We have
thank
10
you.
minutes left, which is a short time. So maybe we can split in groups for 8 minutes and come back 10:28. Is that possible, Manuela, to put us in our groups? Okay, welcome back, everybody. When we had the presentation of Karin and Nicola, there were much more people in the room, but we are happy with everybody. We are running out of time, and I'm almost to blame for this as the organizer. But Isabel, are you back in? And then Isabel Gulings. I don't see her yet. Yes. Isabel, can you update us on what was discussed in your group with Nicola?
Yes, absolutely. We only made it to the first and the second question. Yeah, apologies for the voice, but we discussed indeed the main threats. And the first one that, of course, came up was climate change with all the consequences next to it. Then was also discussed about the complexity of complying with all these regulations. And so companies, SMEs, bigger companies, everybody imports food, and there's a lot of contaminants to take into account and how to deal with that. Basically, it's about risk prioritization. And a very important one that was also brought up actually in the group was the economical equality, so that actually leads to a higher risk for food fraud and food security. And then we moved to this next question saying, okay, what can we do in this? And first and foremost, very quickly it came up, we need to have conversations between all parties, being it risk assessors and risk managers, but also between all supply chain actors, and then also with the governments itself. Yes, economic
thank
equality.
You very much.
That's it.
Thank you very much. Really nice input.
You're
So
welcome.
in our case, we only made it to the first question. And that question was if labels like NutriScore should be mandatory or voluntary. Well, I think the consensus is that it would be better when it is mandatory. Of course, we need a very good label for this, and then in that sense, it can increase trust. And then this was followed up by some discussions about specific products like oils, or some products where you have different portion sizes, how this would affect the NutriScore. But I think the main part was about should it be mandatory or voluntary? That's it from our side. I really would like to thank Nicola and Karin for their presentations. You have to know this was the most interactive webinar ever we had from Titan. A lot of questions, really great answers. Well, I deliberately took some time from the separate sessions because I liked the discussion and the questions. So we hope that we stay connected with you. Maybe I see you again, Nicola, in May in the IAFP conference. Who knows? And Karin, of course, we will also be in touch. And I thank all the people that joined the webinar and that interacted with us. Please keep following Titan and let's stay connected. I think that's the key message of today. Thank you all very much.